Greetings, Dr. Matthew Korn here, 65 Plus Center for Active Aging with your virtual physical therapy session. Today's subject is hip pain. Don't want to do specific diagnosis because obviously there's a lot into figuring out what exactly is with your hip. But if you're having generalized hip pain, it could be from a sprain or a strain, something we call capsulitis or a capsular irritation, or perhaps maybe you just have some weakness or some mild arthritis. All these are going to be appropriate to you. Hip pain typically comes on slowly unless there's like some type of fall or blunt force trauma. And then what you'll notice is it really impacts your gait. So gait pain, gait difficulties and pain with performing certain activities such as walking on uneven surfaces, walking stairs, squatting, reaching down to the floor, those can be indicative of some limitations in the hip joint itself. We're going to go over a few exercises I think you can do to help manage that. I would be doing these anyways if you're looking to build a solid program to support a degenerative hip condition, or if you're looking just to improve your hip function, whether it be range of motion or strength. So I'm going to stand up here and hopefully you can see me. We're going to start with log rolls. Now this is going to apply to both legs, but I'm going to demonstrate it on just one at a time. So sitting upright or laying down, I'm going to sit upright because we're shooting a video here, and using my foot as a gauge, my foot is pointed at the 12 o'clock position, and we're going to turn it as far to the side as we can till you're at the 9 o'clock or 3 o'clock position. Obviously, if it's my left leg and I'm looking at my own feet, this is going to be the 9 o'clock position. And if I'm doing the other leg, it would be from 12 to the 3 o'clock position. We call these log rolls. You can turn your hip inward as well. So if you want to incorporate turning them out and turning them in, maybe from the 9 or 10 o'clock position to the 2 or 3 o'clock position on both sides. You can do that as well. And I would do 12 repetitions on each side, pausing briefly, keeping that knee as straight as you can. Next exercise you want to do, and I want to caveat this, if you've had a hip replacement, please talk to your physical therapist or your orthopedic physician first before doing this type of exercise. And actually, for any exercise that matter, you may want to consult with a healthcare professional before beginning any specific exercises. These exercises are mostly for example only. So you're going to lay flat and you're going to reach that knee and bring it towards your chest. It doesn't matter whether you can bring that knee all the way to your chest or not, as long as you're giving a pull and you feel a stretch on your backside. If you feel your back arching or your opposite leg starting to lift off the table, try to correct that. I'm going to hold that for up to 10 seconds. Straighten the leg and repeat. I would do this 3 to 5 times per side. I'll do it 3 times for you today, holding for about 10 seconds. It's good to have a wristwatch or a wall clock handy so you can watch the clock, because you're going to tend to count a lot faster than the actual time it takes to hold that stretch. And we're holding that stretch a little bit longer. And I'm going to come upright. And we're going to go into what's called a Thomas stretch. And a Thomas stretch is stretching the front of your hip. So you want to be careful laying on the edge of your bed. You're going to drop one leg off the edge of the bed, or in this case, the table, and you're just going to lay back, trying to keep your knee bent the whole time. So if you find your leg way up here, then you got some serious issues, and you may need to sit up and perform this stretch until you get a little bit more flexible. But ideally, you'd be dropping that leg off the table. You'll be feeling a gentle pull in the top of your thigh. And as you lean backwards, you can come back on your elbows or lay flat all together, and your leg should stay lower than the table. Again, holding for about 10 seconds. And the best way to come out of this stretch is to just bring the leg back on the table, sit upright briefly, and repeat. Drop the leg off, lay back down, hold for about 10 seconds. And bring the leg back on. Again, 3 to 5 times per leg. Next exercise we call a piriformis stretch. Essentially, you're stretching some muscles that rotate the hip outward. And we do that by crossing the legs over. Again, if you've had a hip replacement, make sure that you get clearance from your physical therapist or physician first. And you just pull that leg across your body until you feel a stretch in the back of your hip. You might feel the stretch lower toward the upper part of the thigh, and you may actually feel a stretch in your lower back. What that usually means is you're tight in many muscles back there, and you're probably stretching more than one muscle. But ideally, this would be targeting some of the external hip rotators, and particularly what we call the piriformis muscle, which tends to be the tightest. Again, about a 10-second hold. Always come out of the stretch and repeat about 3 to 5 times per side for a 10-second stretch. I'm only doing these a few times per so we can get through it. And next we're going to go into what's called an IT band or a TFL stretch. Those are just names of tissues that you're stretching when you're doing it. You're going to lay on your side, draw your leg back behind you, drop it down below the table if you can, and you should be feeling a stretch on the top of your thigh. If not, then you might want to scoot a little further toward the edge, be safe, we don't want you rolling off the table, and try to drop that leg even lower. There are many ways to stretch this muscle, but I think this is the safest. You can do it in standing. I might show that in a future video. Again, bring the leg back on the table, bend the knee slightly, and go back into the stretch. And then what you're going to want to do when you stretch the other leg is you're just going to kind of come to the other end of the table or bed and repeat the same thing with the opposite leg coming off the table. I'm tighter on this side. I can already feel it. But I just want to demonstrate how do you do that on a bed or table where you only have one side to work on. You can move your body from one end to the other to make it work. Next, we're going to come into standing, and we're going to do some hip hiking. And what that looks like, you're actually going to be exercising the leg that you're standing on. So you're going to hold on to the bed, back of a chair or table, and you're going to lift the opposite leg, the outside leg, hip toward the ribs, and then come back down. So my left leg is in motion, but my right leg is supporting my weight. And you'll probably feel it on that stance leg, that leg on the right. And again, let's say 2 to 3 sets of 10 to 15 repetitions. It's quite fatiguing on that stance leg. And then you'll turn around 2 to 3 sets with the other one. And again, this is one of those exercises where you might feel it's a heck of a lot easier on one side. Standing on my left leg seems to be much easier than standing on my right leg, which makes me question what's going on that right side. So that's called a hip hike. And then lastly is a hip swing. You can use the back of a chair. You can just make sure you have lots of space so you don't want to knock anybody. And you're going to hold on to that chair or edge of the chair or table, and you're going to point your toes up, and you're going to swing that leg forward and backwards like a pendulum. Again, about 10, 12, 15 swings. So now we're putting things in motion. You're actually shifting weight. It's more of a dynamic exercise. Can get a little fatiguing for the leg that you're standing on, but you're also mobilizing the leg that's swinging. So there's really a benefit to the muscles on the right and the joint on the left. And once you've done those 10 or 15 swings, you repeat that 2 or 3 times, turn around, and the outside leg, you're swinging. Make sure you don't arch your back. Hips are nice and straight. If your foot's hitting the ground, point those toes up, or you can step on a book on the stance leg. So there you have it. 7 exercises that might address a variety of hip issues such as pain, range of motion limitations, or weakness. They're all appropriate for most age groups, and even appropriate if you've had hip replacement. But if you have any reservations, you might want to check with your physical therapist or physician first. If you like this video, please give us a thumbs up or subscribe and share it with your friends. This is Dr. Korn with 65 Plus Center for Active Aging with your virtual physical therapy session. We'll have a new video up next week, likely focusing on the shoulder complex. Thanks for watching.